So then, once you figure out, yes, you could help them,
Sure.
what kind of stuff do you walk them through, or what kind of stuff do you do?
Well, again, my hands are pretty much where my skill set, my hands and my brain. That's what I use. So I'm a manual therapist, and I use a lot of my hands, but you have to sense and feel how a joint is moving, how the tissue may be restricting that joint from moving. Okay, and then after you did your evaluation, or what we'd call your differential diagnosis, you then go ahead and will assess the joint and see if what tissue is restricting that joint from functioning truly like it should be functioning. Once you restore, you get rid of their pain, you get back their range of motion, you then can begin to strengthen them and work them back towards their quality of life.
Is that done through exercise?
You can do exercise, absolutely. Exercises will be a huge part of that. The key thing that I caution is that we're not going to push the exercise until they have the right mechanics. I always use the adage that, you know, people will have, say, if you have a car and you got a flat tire in the front, you just keep filling the tire up, and you think you're losing tire right?
Yeah.
You need a front end alignment.
Right.
It's not the pressure in the tire.
Right.
So making sure that you don't put the cart before the horse. I can't strengthen you unless you have the proper movement and mechanics, or I'm creating a negative pattern.
Right. So you use your hands to do that. And then do you have any special machines or any kind of therapies that you use to help people as well?
Well, we use strengthen. I mean, I'm a big practitioner of doing functional movement, using the individual's body, stabilizing, strengthening. We use everything from their body weight to bands to balls to other products. Also have some medical devices that I've created that help to go ahead and foster greater motion with reduced pain, returning them back to their quality of life in a quicker pattern because of how it allows them to move more functionally designed, and there's not a lot of room for them to go ahead and cause compensation. Patients will compensate quickly if they don't like the pattern because that's what they're used to and what their brain has told them to do for so long. So therefore it's making sure that, you know, they're on track. Mm-hmm. So giving them products, devices that will keep them on track, keep them out of pain, because if a patient's in pain, they're not going to do it. You could tell them to do it 100 times, they're not going to do it.
Right.
And their brain's hardwired to tell them to stay away from that, which is understandable.
Sure.
The key thing is, again, is putting them in the right position to get back to their quality of life.
So that brings up, what kind of things do you use to keep them so they don't compensate and they're out of pain, and keeps them in the right position?
Well, the education is huge.
Yeah.
The education is huge, from simple talking about mechanics sitting at your desk. Everybody has computers nowadays. So everybody's sitting at a computer. Everybody's complaining of neck and back pain. Why? Well, we're sitting all day. The lumbar spine, your back is not designed to sit, but we do. So we wonder why we have back and neck ache after a while. Mm-hmm. The key thing is establishing, if we're going to go ahead and put our body through that stress, then we're going to have to make sure you build up your support system. And that would be through strengthening program to go ahead and make sure their body is able to handle that stress.